where we have to start aligning incentives better, and as insurers start finding ways where there's a lot more order, there's a lot more safety around trying new things. We didn't get here overnight, we're not going to get out of it overnight, but there's tons of things we can do. Remember also there's a large continuum between, if you think back to the old fee-for-service and capitated, there's a lot of range in there for value-based payments that can surround a lot of different things: price, quality, setting, location, all of those things. It's very complicated. We're not going to get it overnight. I think what we're trying to do is make the first steps, and even those are hard, because it's hard to define what success is and where the value is.
Well, I think we're well on the way of making changes in our healthcare delivery system. I think the ACA really did stimulate some pretty significant changes in our industry, both healthcare and health insurance. And because of that, I think providers, whether they call it population health or other names, have really made the decision that we really do have to add value and improve quality, take out cost, and so I'm very optimistic, and I think that the integrated delivery systems in Wisconsin in particular have focused on value, and today it's a completely different day than it was even 5 years ago. As Mike says, it's not going to happen overnight. It took us 30 years to create a future service system to get us to this point in time. You're not going to make these changes in 1 year or even 2 years. It's going to be an evolution with, I think, the winners being successful at creating value.
I think the right conversations are happening, though. People are starting to talk about how do we drive value, how do we reward higher value care, lower cost, and so the right conversations are happening. I think one of the other sticking points that people are working through is that there are questions about what data do you actually use to define value. And so there are a lot of clinical measures or a lot of things that you can get from your claims data which may or may not actually equal value. And so a lot of times what we call value ends up being utilization control again.